Burr selection for crown preparation is a matter of personal choice. I generally use a 330 carbide burr and or a tapered diamond to reduce the incisal edge of the tooth by approximately 2 millimeters, and then I initiate facial, lingual, mesial, and distal interproximal reductions. The preparation without the need for pulp therapy can usually be completed in 3 to 4 minutes. These preparations do require the removal of more tooth structure than we ordinarily would expect in a conventional stainless steel crown. This increased reduction is necessary in order to use a natural-looking and appropriately sized pre-veneered crown, which will ordinarily be 1 to 2 sizes smaller than the conventional stainless steel crown. This is in order to accommodate the thickness of the veneer and to ensure a passive fit of the crown. After removal of all decay, if you are close to a pulp exposure, or if you do have a frank pulp exposure, appropriate pulp therapy must be performed. A critical factor in tooth preparation for pre-veneered crowns is the extension of the preparation subgingivally, perhaps a little further than for a conventional stainless steel crown. The further the preparation extends subgingivally, even below the free gingival margin, the more retention you will have and the better aesthetics you'll have in the long run. The final preparation should have a feather-edged margin. With this increased reduction and going further subgingivally, you're going to anticipate and get more hemorrhage than you might normally in a stainless steel crown preparation. Hemorrhage and moisture control are not critical issues for these restorations. All of the crowns should be tried on simultaneously. If the crowns do not all fit together and do not seat passively, more tooth reduction may be necessitated, as in the case of this lateral incisor. One of the most critical things in using pre-veneered crowns is to avoid at all costs the snap fit. In the conventional stainless steel crown technique, you typically crimp the crown to get as much snap fit and retention as you possibly can. With a pre-veneered crown, the snap fit is counterproductive as it causes flexing of the metal substructure of the crown as you seat it over the height of contour. This flexing transfers stresses into the aesthetic facing, causing microfractures and the potential for cracking or even the total loss of the veneer. If crimping is deemed absolutely necessary, minimal lingual crimping is okay. After the preparations are completed and all the crowns fit passively, the product of choice for cementation is a glass ionomer cement. A clinical study done at the University of Nevada found that NuSmile crowns cemented with the glass ionomer cement and with a passive crown fit in the absence of crimping will retain 99% of the time. A careful check of the occlusion following cementation, observing for any areas of heavy occlusal forces on the crown teeth, is advised. In some cases, especially in the canine area, it may be necessary to reduce the opposing tooth very slightly. Final cleanup should not be performed prior to the cement being completely set. NuSmile crowns are manufactured to be universal in shape in order to reduce the number of crowns held in inventory. The crowns are amenable to custom contouring, though rarely is this contouring necessary. Rounding of distal point line angles and fine-tuning, if desired, can be accomplished using standard finishing discs and/or finishing points.